Welcome to How To for Dermatologists. I'm Neil Bhatia, your host, and I'm in the middle seat with two of my surgical mentors, Dr. George Haruza, Dr. Scott Deinhardt. And this is a series I'm talking about how to make some practical pearls from the experts into your practice work and which patients are going to benefit from the most. And right now we're going to talk about how to improve your wound closure technique. And George, you've got a lot of good pearls on simple wound closure. Just walk us through, you're in the middle of the surgery, how do you know which closure is the right one at the right time?
Well, I look at three things. First off, you want to look at, is there any area like the lips, eyelids, side of the nose that you want to keep in place and you don't want to move. You don't want to cause any pull or tension on it. Number two is, where's the extra skin? Is it outer cheek? You can get some more skin out here, or maybe by the side of the nose. There's extra skin, so that's the skin you can move in. And finally, you want your stitch line to match the relaxed skin tension lines, which is really the lines, if you look at your smile lines and how they curve, that's where you want to put your suture lines. And that I think is those are the three main things. And the repair that I was thinking of that is a good, easy flap, if you can't do a primary repair, which is my primary way to fix defects, would be an island pedicle flap. Nowadays we call it the V to Y advancement flap.
So if you had a little diagram of the flap, where would we want to use that on the face?
So use that flap. My favorite places to use it is on the upper lip area, side of the nose, and eyebrows, also medial cheek. And the benefit is that you're using immediately adjacent skin. You don't have to undermine a lot. You don't have to move a lot of skin. So it makes it very easy. You don't have to worry too much about the anatomy and so forth. The key thing with this flap, because it's kind of gotten, some people don't like to use it because they say it causes a lot of pin cushioning. Mm-hmm. But the way you can eliminate that problem is that instead of undermining the traditional way where you make your cuts down and then slide the flap up, you actually do what's called a bipedicle flap, where you undermine laterally. So you undermine laterally superficially and then undermine under the flap. So you undermine totally under the flap and you kind of have this sling going in. And so with the sling, you slide it up, and what happens is, because of that undermining, you actually end up with a plate of scar tissue which prevents pin cushioning to form.
So Scott, do you have the same experience or same approach?
Well, I think George has some very good tips or pearls with the flap. I don't do as many pedicle flaps because I'm a little wary of the you'll end up with two lines. I'm not as big a fan of that, but I think it is kind of a workhorse for a lot of people. Mm-hmm. Also, I think with my tips, I'm going to probably present a few that are, I agree with George that when you can do a nice linear closure, you can take those techniques and you can put them into something like this, and you're going to get a better result.
So one of the more important tips goes along with eversion. And maximizing eversion. It's called the boat phenomenon in your idea.
Yeah, I think when I'm teaching residents and medical students, I see a lot of times where what they're doing is I try to avoid the boat, is what I tell them. When they make the excision, they tend to make it a boat-like shape, and that makes it really hard to push in and evert. And what they have to do is they have to learn to take their scalpel straight down, or even a little bit less intuitive is to actually take it a little bit at a different angle. Mm-hmm. And it's not real intuitive, it's really a little awkward, but you teach yourself that and your closures will really come together a lot easier. Yeah. It'll be a lot easier, especially the larger excisions.
And does that help to minimize dog ears and some puckering, or is there any other advantage to that?
I think the biggest advantage is the eversion you get, to be able to get it together versus the dog ears or puckering.
And the right suture is also important, as you see here.
I think it is good to have the best suture, the right suture. I think in this tip, the main feature is that we all have problems with spread scars, and there are a lot of things that we could do. We could give tips all day on spread scars, mm-hmm. but one of the things that I think is something that people should do more often is pick a longer acting suture for their excisions that are on their back and chest. Those spread a lot. If you can get something like PDS that hangs around for a year versus Vicryl, which hangs around for a couple of months, mm-hmm. you're not going to see the spread scars that you saw with your other excisions.
And finish us up with the vertical mattress.
Yeah, the vertical mattress, specifically the loose vertical mattress, is really my tip. When you put a vertical mattress in and then you come back to take sutures out, you'll notice that it's always dug into the skin. And the way to avoid that is, number one, put it in loose, very, very loose. all it's doing is pushing the skin up. Vertical mattress, the main purpose of it is to get eversion. Once you get the eversion, you can put your simple interrupteds and put the rest together. And I think a good tip, probably another tip, is to take out your own sutures. I think George would tell you that you'll see a lot of technique errors if you take out your own sutures.
Oh, that's excellent.
You definitely learn. I was going to say though, rather than the vertical mattress, I find for eversion really running horizontal mattress suture much quicker than doing the vertical mattress.
Yes,
and you get a really nice eversion, so that would be another option.
It's a great technique.
Oh, that's excellent. Just lastly, real quick, when is too much electrosurgery harmful?
Well, I think if you see black char, that's too much. So you really want to cauterize only what you need to stop the bleeding, and I would recommend using a grounding plate because that way you can channel the energy channels down the vessels and you end up with a lot less char.
Yeah, I think my only comment is it's balance. You can't get a hematoma, but you definitely want a dry field. It's somewhere in that area.
Yeah, the bleeding patient is never a happy patient, last time I
correct.
checked. So, well, George, Scott, thanks for all these pros. These are really great, especially for someone like me who's still learning surgery at age 50. So thanks very much. And this has been another episode of How To for Dermatologists, and we'll see you next time.